Hello, and welcome to Conversations from the World of Allergy, a podcast produced by the American Academy of Allergy, Asthma, and Immunology. I'm your host, Dave Stukas. I'm a board-certified allergist and immunologist and serve as the social media medical editor for the Academy. Our podcast series will use different formats to interview thought leaders from the world of allergy and immunology. This podcast is not intended to provide any individual medical advice to our listeners. We do hope that our conversations provide evidence-based information. Any questions pertaining to one's own health should always be discussed with their personal physician. The Find an Allergist search engine on the Academy website is a useful tool to locate a listing of board-certified allergists in your area. Finally, use of this audio program is subject to the American Academy of Allergy, Asthma, and Immunology Terms of Use Agreement, which you can find at www.aaai.org. Today's edition of our Conversations from the World of Allergy podcast series is targeted towards allergists and practicing clinicians, but to be honest, the information we're going to discuss today is also extremely pertinent to families with school-aged children and school personnel as well, and I think you'll find this very useful. Today's guest is Dr. Alice Hoyt. Dr. Hoyt is the founder of the Hoyt Institute of Food Allergy, located in Metairie, Louisiana. Dr. Hoyt is an active member of the American Academy of Allergy, Asthma, and Immunology and was the inaugural recipient of the Quad AI Educator Development Award in 2020. Most recently, she serves as a faculty member and content author for the online CME course titled How and Why to Prescribe Stock Epinephrine to Schools and Early Childhood Centers, which makes her the perfect guest for today's episode. Dr. Hoyt, thank you so much for taking time to join us and welcome to the podcast.
It's my pleasure. Thank you for having me.
Oh, absolutely. I think this is going to be a great conversation and very useful for our listeners. You and I, for the audience, for our listeners, you and I know each other and we share many similar passions with the work that we do. And I'm excited to talk about stock epinephrine, but I'd really like to start by having you discuss why you became interested in being an allergist and then pivot more towards what inspired you to focus your career on food allergy.
Absolutely. So I think hindsight's really 2020, but growing up in Southeast Louisiana, I spent a lot of time at my grandparents' farm, and my grandmother was a great cook and grew wonderful fruits and veggies, and just learning all about nature and foods and how foods interact with our bodies was always important from a young age. Eating healthy, and so my degree was in nutrition because I was just always fascinated by how foods interact with our bodies, and knowing that I wanted to go to medical school, I wanted to have a degree that was very, very relevant to some of the issues of the day. And definitely in the South, we have issues with obesity and
Mhm.
all the food associated things, right? So going to med school, did internal medicine and pediatrics, combined residency, and was just really fascinated by the immune system and how our bodies and the outside world engage. And one of my mentors recommended I check out allergy and immunology. And I did a few days on the service and started looking at Jackie in practice, and I was like, oh my gosh, this is where I'm supposed to be. And so I was blessed to match at a wonderful program, Wahoo Wah UVA, and did an additional year at UVA, and just knew when I was there that food allergy is absolutely where I want to focus all my efforts. And I am blessed because that is what I do now, all food allergy, all the time.
That's amazing. So if you had to think back to the time on the farm, what's the one food that you think about that makes you salivate? What was the best thing that you would eat when it was nice and fresh?
Oh, oh heaven. So strawberries. Ponchatoula is the strawberry capital of the world, and my grandmother grew the most amazing strawberries. So strawberries and her strawberry pie.
Oh my gosh. All right. Now I'm hungry. Oh
Are
boy.
you
Okay.
salivating now?
Uh,
Yes.
yeah, well, yeah, this sounds really good. When
It
people
won
listen
blue
to this,
ribbons at the fair. It's good stuff.
your grandmother's strawberries, like her specific strawberries, won blue ribbons?
Her strawberries, making her strawberry pie. Oh yeah, blue ribbons, multiple.
Oh my gosh.
My
Okay.
grandmother was a boss.
Oh, wow. All right. It makes me want to visit. Um, when people listen to this podcast, it's going to be a little bit later than the Food Allergy Awareness Week, but that's actually when we're recording it. We're in the middle of that right
hmm
now. What does this week mean to you, and what message do you think we need to send to the general public surrounding food allergies?
That's a great question, Dave. And I was posed this earlier because there is a lot of media right now around food allergies because it is Food Allergy Awareness Week. And what it really means is, to me, it's sort of two parts. If you have a food allergy or if you have a kiddo with food allergy, then this is really a week to feel like, okay, the world is listening. When other times, sometimes our families I know feel like, are you hearing me? Do you see that my child has this? And so this is a week where they can take heart in knowing, like, yes, there is a whole week. People are
Hmm.
aware. People are listening. And then for people who don't have food allergies, I think it's such an important time for them to look to their friends and family who do have food allergies and say, how do you use that auto injector? Or, not all food allergies are anaphylactic, thinking EOE and FPIEs, right? Asking those family members, tell me a little bit more about this. I'm hearing all this about food allergy awareness. Like, what does that really mean to you? And ultimately providing an opportunity for engagement between people with and without food allergies.
Oh, I love that, and I couldn't agree more. And, it's funny when I talk to all the patients I have, or parents and caregivers of children with food allergies, like they don't mind when people ask them questions. They love it. They love
Right.
the opportunity to
Right.
discuss what it's like. Yeah, that's great.
Yes. Yes.
Well, pivoting to the topic of today's podcast, over the past decade, just about every state within the United States has adopted either voluntary or mandatory stock epinephrine legislation for schools and early childhood centers. Why was this movement started in the first place, and why do you think it's important?
That's such a good question. So why was it started? It was started because food allergy it exists, first of all. I know we're speaking mostly to allergists right now, so I don't really need to like drive that point home. It is
Mhm.
life threatening, also a point I don't really have to drive home, but those are 2 points that were not very well known even just maybe 10 years ago. And so having the legislation that encourages or requires schools to be prepared for anaphylaxis, meaning having epinephrine autoinjectors, having their staff trained, that legislation really helps push push the ball forward or throw the ball, whatever sports analogy you want to use, right? To get our schools more prepared to manage this medical emergency, because it's not a matter of if, it's a matter of when a school is going to have a child or a teenager have an anaphylactic reaction at school. And so in 2013, there was federal legislation that encourages schools to adopt stock epi, but states were doing this even before 2013. And unfortunately, some of the state legislation came from children dying in schools because schools were afraid to have the auto injectors. And so, that's so fascinating, especially I think for some of the younger allergists listening, that wow, that was even like a thought that, oh, we might get in trouble if we have this auto injector. Whereas now the legislation really across the country is saying to err on the side of caution is to administer stock epi when you think someone is having anaphylaxis. So really the pendulum has swung, and that is why now all states except Hawaii have legislation that either requires schools to have stock epinephrine or encourages them slash permits them to have stock epinephrine.
Hmm. And if I recall, it wasn't just students, right? We're talking about adults that are on the school campus, from, bee stings and hymenopterin, venom
Right.
anaphylaxis and things like that as well, correct?
Absolutely, absolutely. I mean, anybody, right? We all know that anybody can have an allergic reaction. Of course, in kiddos, sometimes they're having their first reaction at school. And what do you do if they don't know they have a reaction? They're not going to have an epinephrine autoinjector. But absolutely, it's similar with AEDs. Heaven forbid there's a sudden cardiac arrest at school. But oftentimes, it's not just going to be a student who will benefit from having that life-saving medication or device.
Hmm. Well, as you mentioned, on the federal level, it was more encouragement for states to enact these laws, and thus each state really has its own legislation. There's a lot of overlap between them. We'll talk about some of that nuance soon. But do we know how many states actually have mandatory stock epinephrine laws that say every school and early childhood center has to have this?
There's certainly a handful. I will say 12, 13 dozen ish, something like that. The reason I say ish, something like that, is because when you really get into the weeds of what these statutes say, it typically has this is required pending funding.
Hmm.
And so if the legislature does not provide funding, then it is no longer required. um, so it's very interesting to read reviews about what states have what legislation. And what I encourage you to do if you're listening to this and you want to get involved with writing stock epi, which you absolutely should, it's incredibly rewarding, is look at your actual state law. do not trust what anybody else says. Go and look at your state's law and see, okay, what does my state permit? And also there are some local regulations too, like in New York City for childcare, there is local regulations. So check your local law. Don't listen to what other people
No, I think that's great advice. And more
say.
importantly,
As I'm telling you what
you know,
to do, don't listen to what I say.
well, well, I mean, you count, of course, um, but also don't assume that just because there's legislation in your state that that school down the street automatically has their stock epi. We're going to talk about some of the challenges in that, but yeah, don't make any assumptions that oh no, it's going to be fine. They'll have their own epinephrine or things
Oh,
like
heavens
that.
to Betsy, Dave. You're hitting the nail on the head. We all know what
Well,
happens when you assume. No, don't assume that just because it's required. I'm putting air quotes. I know this is a podcast, but I'm making quotes with my fingers. Just because something is required by law does not necessarily mean that it's actually happening. So yeah, check with your local school. Get engaged. See what's happening.
yes. Well, let's break it down a little bit. So, what are some of the main elements that most of the states include in their stock epinephrine legislation? So, what do they say that these are the at least minimum requirements that need to be in place?
Okay, so some of the first verbiage that you'll see is either shall or may, and that's really going to lay out whether or not this is required or this is permitted. So that's kind of your first fork in the road. And then it's going to get into what is stock epinephrine. It'll typically have it's an epinephrine auto injector. Some laws do not necessarily lay out that it's an auto injector. And I have worked with a state in the past that the legislation did not lay out that it's an auto injector. And so then when this particular state, it's required that the schools have stock epinephrine. The law does not say auto injector. So then when there was an issue with an auto injector program getting auto injectors to schools, then they were relying on vials of epinephrine and syringes, to which if you're an allergist and you're listening to this, you're cringing right now, right? Yes. So we were able to work with a different auto injector company, and I have no support by any auto injector companies. We were able to work with a different auto injector company to support those schools and get them a safe option. And so that, Dave, what was the question? Please note, I had a baby 11 weeks ago, so
Oh my gosh,
I'm
I did
working
not
on
know
little
that.
sleep. And I just went off on a tangent on my own podcast. I go off on tangents all the time. But so what else is in the law? What else is in the law? So you have that first decision tree of is it required or is this a may? It's permitted. And then is it an auto injector? We all want it to be an auto injector. And then who can use it and what sort of training
Mhm.
do they need to use it? And what sort of indemnification is there? Meaning, if a staff member who is trained on using the device recognizes someone having anaphylaxis, they in good faith think that's happening and they use the device, can they be in trouble? Most of the laws indemnify the staff members who are trained. Most of the laws indemnify the prescriber. Most of the laws indemnify the prescriber. Most of the laws indemnify the prescriber, y'all. So we as prescribers won't be held liable if, God forbid, there is a bad outcome. Now, of course, if someone uses an auto injector as a weapon, the laws do not indemnify that. But that's about the only thing that is not indemnified with this legislation. So those are the things that you want to look at in your state code.
Okay. Well, congratulations on your new little one. What's their name?
Thank you. Walter.
Oh, Walter. Is Walter sleeping right
Yeah,
now, or is
little
Walter on your lap?
Walter is sleeping. Walter is often on my lap though. So whenever I do local interviews or podcasts sometime, Walter makes a little appearance. Just like little Adelaide used to make appearances, who is now 3.
Oh my gosh. Oh, well, congratulations again.
Thank
Um,
you.
do we have any data or evidence regarding implementation of these stock epinephrine laws and how many schools or districts have participated in these programs?
Not on a state level. There are some lovely studies by fantastic people across the country who do get involved in what's going on in their school districts. But they're not robust studies, neither in states that require nor permit of what sort of implementation is really going on. Even though in a lot of the laws, and I should have put this in my last answer, but I'm clearly sleep deprived. A
Mhm,
lot of the laws do say that there has to be a reporting mechanism, typically to a Department of Health.
mhm.
But but that doesn't always occur. So unfortunately, we don't get to see all of that data because it's not being reported. But that is something that we are working on.
Yeah, and I've been along with yourself and many others. I've been working on this in my own state. Oh my gosh, for 7 years now, and that was one of the things from the beginning of just we need to be able to track this on some level to get a better understanding of
Mhm.
where the holes are, because we're talking about
Mhm.
these states are huge and the counties there's such disparities in regards to access and things like that. So I'm glad that you're working on that. But oh boy, that is such a major
Absolutely.
one of the things missing in my opinion.
Right. And Dave, I'll give a plug for my nonprofit, Code Anna, codeanna.org, and we equip schools for medical emergencies like anaphylaxis. And I mean, just like you, I can't tell you how many stock epi prescriptions that I've written. And Code Anna is the one that helps facilitate all of that to make sure that they're trained and they're able to get a prescriber in their state. I actually still have my Ohio license because and I'm in Louisiana now because I still prescribe up there to help get these devices not just into schools but also into non-school entities.
Mm,
And just to take a step back for a second, if you're looking at your state's legislation to figure out where you can prescribe to for stock epi, typically states have stock epi legislation for schools and then non-school entities. So that's sort of a fork in the road there too. And a non-school entity will often include early child care centers, so pre-Ks, but then also universities. So when we're talking about school stock epi, we're typically talking about kindergarten through 12th grade. It's also important to note that kindergarten through 12th grade are the schools that qualify for EpiPens for schools, which right now is the only, at the time of this podcast at least, it's the only school program that's providing EpiPens, specifically EpiPens, to schools at no cost. There are other public access programs that are available where schools can get them at lesser cost than what we all hear about in the media of these hundreds or thousands of dollars. Um, but yeah, just if you're interested in writing stock epi, I keep coming back to that because it's
mhm,
just so important, Dave. You know that.
mhm,
Um,
mhm.
but yeah, it's just so important. So there are ways to get these devices.
So let's expand upon that if we can. So who's in charge of paying for these? Let's say for whatever reason they don't want to participate in the EpiPen for Schools program. Does the school district themselves can they just pay for these? Go to the pharmacy and pick them up. Are there advocacy groups? You mentioned your nonprofit. What other avenues can schools look towards, or can more importantly listeners direct schools towards if they have trouble paying for these?
So the first thing you want to try is that EpiPens for schools. And if you're K through 12, then you should be able to qualify for 2 pairs of auto injectors, and depending on what age groups you have in your school. So if it's a lower elementary, you might want to do one junior, not junior, right? We don't like to say that. One 0.5,
Hmm.
0.15, sorry, and one 0.3 auto
Hmm.
injector pair. If you're high school, do two 0.3 pairs. But if you don't qualify for that for whatever reason, then you want to look at public access programs with some of the distributors with medical purchasing solutions. You want to get with a local group that is doing this, or reach out to Codiana or any of us really, who are doing things on more of a national scale to help facilitate that, because that's absolutely one of the biggest questions is doctors want to know, are they going to get sued, and then they want to know, well, where can they get these, right?
Hmm.
But they can also old school, write the prescription on a sheet of paper. You write the prescription out actually to the school because it's stock epinephrine, so it's going out to Little Oak Elementary School. It's not being written to the nurse of the school, assuming the school even has a nurse, but it's
Hmm.
going to the actual school. And then they can take it to Target Pharmacy, to Walgreens, to fill in the blank. A lot of times, though, I will tell you, the pharmacies are not as up to date on the stock epi legislation. So they're going to be like, you want me to fill what?
Hmm.
Which is why actually right now I'm working with Dr. Andrea Pasquardo on an amazing stock epi and stock albuterol toolkit that's going to have some of this information in it. But also, I know you're going to plug the online course that we have available right now through the Quad AI
Hmm.
for CME credit that walks you through all this. But yeah, you write out the prescription to the school. They can take it to Target, wherever, and also use that. This is it. Use the GoodRx whatever that discount is at that time, go to goodrx.com and type in EpiPen and see, okay, Target has it for $107.99 right now for a 2-pack. And yeah, it's still $107.99, but that's still significantly less than if you're just going there and just saying, hey, I have this prescription. So those are some ways that you can get these devices for less than the hundreds or thousands of dollars that we hear about.
Oh, those are such great practical tips for everybody. But
It's very in the weeds tips. Yes, it's very in the
yeah.
weeds tips.
Well, the logistics, that's where everything always gets hung up, right? So this is really important.
Totally, totally.
But I keep hearing you say that it requires a prescription, and it sounds like schools are completely dependent on having a clinician who's willing to prescribe the epinephrine for their school. So, what resources exist to help connect these schools? You mentioned not all of them even have school nurses. For our listeners who aren't aware, that's a huge problem. There's very few schools,
Mhm.
percentage-wise, that actually have a full-time nurse in every building within their district.
Right.
So, let alone having a physician within their district. So, what resources exist to connect schools that don't have their own physician with willing participants in their community?
I would say one of the biggest resources is Code Anna because you can just send us an email and Sarah Jane, our director, is if we don't know somebody, and I'll ask somebody who knows somebody in that state. But chances, I mean, allergy world is small, right? I mean,
Mhm.
people listening to this, we're all across the world. So um, that's one way to do it. Another way, so if you're a prescriber and you want to know if the school has a prescriber, you can just ask the principal. And then if they don't, then you can be the prescriber. But if you're a parent and you're like, I need to find somebody, you can check with your health department and see if they're interested. Some local health departments will do this. Some state health departments will do this. There's tremendous heterogeneity across the country about who is prescribing and what. And that's why it's so important for us as allergists to really own this, in my opinion, and get involved with our local schools. It's a beautiful way to give back, and it's also relatively easy. Once you've done it once, you're like, oh, well, that was easy. I can do this a million times. Because
Mhm.
again, the indemnification is there, and it's really just signing your name a few times for a prescription and then also the standing order protocol. That's one of the other forms that you'll have. But those are some of the resources is Code Anna, any of your academy colleagues who are involved in this work, Dave, you, myself, I can think of some others, right? Just reach out to us and we can help. Do you know of other resources that are actively connecting prescribers with schools?
I do not. I know. I think that's one of the other, major holes in all this
Yeah.
legislation of just we don't have a way of connecting people. It really does take a little bit of proactive effort on our parts,
Mhm.
and which is fine. I mean, I think it's easy to do. That's what I've done in our community. Whenever, if there's
Mhm.
ever, a regional school health conference, they love having
Mhm.
allergists present on all kinds of information. And anytime you get, even if they ask you to give a talk on asthma, talk about stock epinephrine. Put that plug in. Let them
Yes.
make them aware of it, and let them
Oh,
know
I love
that it's
that.
available.
That's awesome. That's a
Well,
great tip. I love that.
you've mentioned this just a couple of times so far, but just to be clear, what advice do you have for our colleagues who still may be reluctant to write these prescriptions for any reason, especially if they're worried about being liable if the epinephrine is given incorrectly or causes adverse effects? How can we get people to better understand like it's going to be okay?
Listen to this podcast again. Number one, put it on repeat. Number two, um, send me an email, drhoyt@hoytallergy.com. And actually, I mean, in medicine, we're all about see one, do one, teach one, right? And so take the online course through the academy, and you'll see, okay, what does all this really entail? And that online course is beautiful. It really walks you through the legislation involved because that's what we're all worried about, right? We're all worried about getting sued. The other thing we're worried about is how much time is this going to take, and if you're able yourself to read the legislation, right? Because we also don't trust anybody. We're doctors. We want to see it for ourselves, review the evidence for ourselves, right? So through the course, it walks you through how to find your legislation, how to read it, what to look for, which is we kind of already talked about that in the podcast too a little bit. But then it walks you through, okay, these are the forms that you can either expect to receive from a school nurse or a principal, or these are the forms that the school will need. They might not know it, but this is what they'll need. And that'll be the prescriptions, that'll be the standing order protocol. And all these things we already have for you. So Codana has already made these. We have given them to the academy to use in the course. We're using them in the Stock Epi toolkit that we're making with Dr. Papalardo. And you have everything. So see one, do one, teach one. So have one of your Quad AI colleagues who is prescribing Stock Epi walk you through how to do it the first time. And then you'll be like, oh, wow, this is easy. Okay. Then another school inevitably is going to come out of the woodwork and want you to write it. Or a parent is going to want you to write it for the school. And so then you're going to talk with the school about it. And you have all of the ducks in the row at that point. You've done it all before and you're like, oh, okay, I can do this. This is easy.
No, I think that's great. And personally, if I may share, I just when I reach out to the schools, and this takes years to kind of build to cultivate these relationships, but they all have my email address, and
Mhm.
now they just email me. They have the
Mhm.
forms, they download them from the website or whatever. They send them to me, and then I print them out and I sign them, I scan them back in and send them right back. And it's just a matter of minutes. Um,
It's easy,
so
right?
yeah, it is.
It's
It is
easy.
easy.
It's easy, and the law's there to protect you. And there are organizations to make sure that they're trained. Because that's the other thing. It's like, oh well, how do I know that they're really well trained? Well, if it's a nurse requesting it from you, then you can kind of sleep a little bit better, right? But still, everybody needs an update in anaphylaxis, right? I mean, we just did the updates for the 2023 anaphylaxis practice parameters update. There's always new coming out on anaphylaxis.
Hmm.
So having a nurse helps you sleep a little bit better. But then there's all these really great training resources. Codiana, National Association of School Nurses, FAAAAI, all these groups have stuff that you can recommend to the school to make sure that those other people, not just the nurse who are going to use that stock epi, are trained on how to recognize and respond to anaphylaxis, including how to use that auto injector.
Yeah, I'm glad you mentioned that because I wanted to ask you. And it's one thing I've heard from colleagues of like they don't want to be involved in developing a new treatment plan or protocol or things like
Hmm.
that. So, do prescribers actually have to develop these for each school? Or can they just sign off
No,
on something that the
no.
school sends them?
Well, so if the school sends you something, read every
Mhm,
line of it before you sign your name to it, right? Um, and in lieu of that, I would encourage you to provide your own content, specifically your own standing order protocol, which is in that course on the Academy's website. And it's a standing order protocol, which you're kind of like, well, what's a standing order protocol compared to the prescription? They look kind of similar. Well, the prescription is more like getting the prescription, how many dispense, all that, right? But the standing order protocol really sort of goes through when to use the device and how to use the device. It's more in depth. So have those forms ready that you have already reviewed, that you are very comfortable signing immediately, and provide those. EpiPens for Schools will provide these to the school, and so the school will then give them to you. So if I may, I'll just walk you through that process because that's how
mhm.
a lot of schools will reach out. Is they'll say, hey, we want to do EpiPens for schools, and we need a prescriber. You say, absolutely. So the school logs in to the EpiPens for Schools program. They will download the forms to get signed. They will send you those forms. Those forms are a prescription and a standing order protocol. And so you sign that, you send it back to them, just as you said, and then you're done. The other thing that some prescribers like to have is an MOU, is a memorandum of understanding. It's not legally binding, but what it really does is it just lays out the responsibilities of the prescriber and then also the school or the school district. So it just, in my opinion, it clarifies the relationship, it clarifies the expectations on both parties, but it's not something that is required, um, especially because we have the legislation. And I keep coming back to that. We have the legislation that really protects us when we are doing this really great community service.
Mhm. It really is a great community service, and you make this just sound so easy. And like you
Well, it
said,
is.
see one, do one, teach one. Yeah. What are some of the other details that maybe we haven't covered thus far, or common questions that you receive about this from colleagues at the schools that you've worked with?
So some of the questions are, well, are being posed to the prescriber. And so how do you respond to that is, well, what if I give the medication and they didn't really need it, right? Or how many times
Mm,
have we as allergists heard that epi was given and then they went to the emergency room and then the emergency room physician said, oh, they probably didn't need it. Or somebody
mhm,
along the way said they didn't really need that epi. And we're all like, no, do not feed that doubt, because we all know that when anaphylaxis is promptly recognized and promptly treated with an epinephrine autoinjector, that the symptoms resolve like super fast in most cases, right? And it's pretty amazing. And I know many of us listening to the podcast have seen the epi work so fast, and it's so relieving, right? Because anytime you're giving epi, nobody is 100% calm when they're giving epi, right? We're giving epi
Hmm.
because they're having a severe allergic reaction. And so when we see that person within, 90 seconds, less than that oftentimes, really just that look in their face change, then start less impending doom, more I'm feeling better. It's amazing. It's amazing, right? And so when I hear that, oh, well, the ER, somebody or other said little Johnny really didn't need that epi. They looked so good. Then I say, you know what? They looked good because it was potentially that epi that saved their life, right? Because you administered it promptly and they started feeling better. Their symptoms improved. It's because of that epi that they looked so good. So in my opinion, that really underscores the importance of promptly recognizing anaphylaxis and administering epinephrine. So that's probably one of the biggest things. One of the biggest questions I get from schools, and one of the questions I get from colleagues, like how do I respond to that? Another question I get and guide my colleagues on how to respond is inevitably when you're talking to the school about anaphylaxis and someone raises their hand and says, well, little Lily in fourth grade, her mom swears that she can't even be in the same room with Peanut, and also on her
Hmm.
action plan it says she has to have 50 milligrams of Benadryl, your favorite medicine, Dave, before she gets epinephrine. What do I do about this? So then you pause because that's the question we're all getting. We're all like wringing our hair, right? And our and so you have to stop and separate administering stock epinephrine from following a student's pres- physician prescribed anaphylaxis action plan. So there's
Hmm.
another fork. Like, are we responding to a child with a known allergy who has an action plan, or are we responding to a child who this is kind of out of the blue, right? In many ways, if it's out of the blue, then the protocol, you follow the protocol. It's less gray area. But if you have an action plan on a kiddo, if a school has an action plan on a kiddo that does not make sense medically, it really puts the school in a difficult position. And so what I encourage my colleagues when they're asked that question is sort of I encourage them to answer with sort of two parts. Like one, for the student, you got to separate, is this a student with a known or unknown allergy who has an action plan or not? If they don't have an action plan, they don't have a known allergy, then bam, you're following the stock epi protocol. But if they have a known allergy, then really before we get to that point, ideally, like when this teacher is asking this question, you want to review that action plan with the parent and make sure that that parent and that student is plugged in with a board certified allergist. And if you still have questions about that student's anaphylaxis action plan, then that school should be able to get in touch with that physician to answer that question. And I know we're all like, oh, well, sometimes, it's so hard to get in touch with a doctor. Like, I totally get that. But when it comes to allergists, I hope everybody here listening, if you're listening to this, then you're engaged in this anyway. This matters to you. You're invested. So I'm not worried about you responding to schools. But whenever a school is reaching out to us, then we've got to respond promptly. We've got to be able to have that phone call with that school nurse and clarify what that action plan is. And if that action plan is not consistent, so if the school is saying, well, this isn't really making sense, then the school really needs to have a way to talk with the parent and encourage the parent to help get clarity on what the action plan really is.
Mm.
That was a really long answer, Dave. Sorry.
No, no,
In
there's
the weeds.
a lot of
In
layers
the
to this.
weeds.
So it's good. Well, all right, here, let me ask you another hard question. So let's say that we have parents and caregivers out there listening, and they say to themselves, "This is fantastic. If my child's school already has stock epinephrine, I can save myself $300 and not fill the prescription and send it to school with them." What would you say to those caregivers?
Oh, so it sounds really nice, right? But ultimately there are a few issues with that. One, I would never trust anybody else to have the life-saving medication that my child needs. I would never trust anybody other than myself, or trusting my child when my child is old enough to self-carry, and even then, I mean, I can't even imagine. My kids are young. Um,
Mhm.
so, so we don't want to trust somebody else to have a life-saving medication, right? Kids who have arrhythmias and are at risk of death, they get defibrillators. They get implanted defibrillators. They don't just trust that the school is going to have an AED to fix the problem once it happens. Um, by the way, my husband is a pediatric cardiologist, so we have interesting dinner time discussions. But so that's one thing, right? The other thing, and Dave, I know that this is, we have so much overlap. I know that this is something that you're passionate about is really the transitioning a child from the pediatric care model to the adult care model. And, I mean, we can put EpiPens on school buses, we can put EpiPens everywhere that a kid who has food allergy is. But that is still failing that child if we are not teaching that child how to be responsible for their medical condition. And when it comes to food allergy, being responsible for your medical condition means having your medication, your emergency life-saving medication available to you at all times, right? And so we have to start teaching our children when they're young, they need to carry this medication. And that is something that if you're a parent and you're listening to this, that you absolutely want to have that discussion with your allergist even when they're little toddlers, when they start talking. Okay, what do I teach my toddler about their food allergy? Do I want to tell them that this could kill them? What sort of anticipatory guidance, right, are we as allergists providing to parents? We've got to provide guidance that teaches the parent and teaches the kiddo that ultimately there's nothing magical that happens at 18, that they're suddenly adults and they know how to do all this. We have to teach them all that along the way. It has to be age appropriate, meet milestones, all of that. And so if we're just saying, oh, well, we'll just have stock epi at the school and we don't have to worry about it. It might be a short term, oh, that might help some, a financial situation, but ultimately, that's going to fail our kids because they're not going to learn the importance of them being responsible and having that device on them.
No, well stated. And just to go back to what we discussed at the very beginning of this, don't assume anything. There's a lot of
No.
loopholes here. There's the Swiss cheese model. There's a lot of holes, and sometimes they're going to line up. And if you're
Mhm.
counting on your school to have that available, and if they don't at the moment that you need it, that's when bad things can happen. So, yeah, I agree
Right.
with you.
Right.
Well, let's go back to this online course that you helped develop through the American Academy of Allergy, Asthma, and Immunology. Where can people find it? Can they get CME for it? How long is it? And what additional information can they learn by watching it? Now, that was like a seven-part question. Sorry.
Yes. So you can log into your Quad AI account and go to the professional development and education. We have amazing education staff for the academy. We have wonderful people that work with the academy. um, and search for the course for epinephrine and how and why to prescribe stock epinephrine. And yeah, you get CME credit. I believe it's an hour. Um, you can email me and correct me if I'm wrong, but it should be like 1.0. And I wrote it to be very tactical, very practical. I had a wonderful people collaborating with me in writing it. So school nurses, other allergists, so that it could really be a course that it's not it's not a 40,000 foot like overview. It is in the weeds, just like this discussion. It is going to answer your questions on how and why to do this, so that you feel equipped to do it.
Is it just like kind of like a webinar that was pre-recorded, or what can people expect when they log into it?
There's a short video in the beginning, but it really is more interactive of reading text and then answering
Hmm.
some fun interactive questions as you go through. There's downloadables. There's great links and resources. So I would say that for being a self-paced course, it's still very engaging and interactive. And my email address, I think, is littered throughout, so that you can really just reach out to me if you have questions.
Oh, I love it. The active learning style. It's fantastic. Our audience might not be aware of this, or now they may assume so, because of how eloquently you're speaking here. But you host a podcast yourself, which is called Food Allergy and Your Kiddo. Why did you get started
Yes.
in podcasting, and what do you enjoy most about it?
So podcasting is so much fun because you can just sit here and talk with, your friends, your allergist, I get to interview amazing people. And Dr. Anna Novak Wegerin came on, and just did an amazing, amazing overview of FPIEs. And so I started it because I found myself having the same discussions with parents over and over and over in my clinic. And I really wanted them to have access to information that was still evidence-based, but really tailored towards families and written in a way, or discussed in a way that is warm and lighthearted, but still gets to the heart of the matter. And so that's what I'm able to do with food allergy in your kiddo. And you've been on it.
Hmm.
excellent episode. And I'm able to like ask my friends, my allergist friends, and all these other people who are allergists that I actually don't know, but I will reach out to you because you are an expert in this, that, or the other. And look, these food allergy families, y'all all know this, they are smart. I mean, they are looking for the journal articles. And so I really started it as a way to connect all these just like amazing, super smart allergy people and advocates with families who are wanting this type of information, but they couldn't really find a place to really find it all. And so that's what food allergy in your kiddo is, the place to find family focused evidence based resources.
No, it's great. Is it mainly designed towards parents and caregivers, or do you think that healthcare professionals can learn some new information as well?
Absolutely, it is for it is for families, right? It's food allergy in your kiddo, but I know a lot of allergists who do listen to it, and they tell me all the time that they're getting new things out of it. My co-host is one of my very, very good friends from actually when we were teenagers, and happens to have a now teenager who has a peanut allergy. And so it's
Mm.
me as the food allergist, and it's Pam as the food allergy mom. It's I think it's fun to listen to us because sometimes we're goofballs, but it also brings very good multiple perspectives, especially when we have guests on, to have really a nice multifaceted discussion. So absolutely, allergists I think get some good information out of it.
And where can our listeners find your podcast if they're interested?
Well, thank you for asking at foodallergyandyourkiddo.com.
All right. Well, as we wrap up our conversation, I always like to allow our listeners the opportunity to learn a little bit more about our guests. Would that be okay with you?
Sure.
All right. So, easy questions as we near the end. What is your preferred vacation? Would you rather relax on a beach or discover new cities? And the follow up is, do you have a favorite spot that you either can't wait to get back to or you have already been multiple times?
Yeah, so I'm definitely the beach person. I like to just go and unplug and just sit there with my thoughts. There are some beautiful beaches in Georgia, a short coastline, but a beautiful coastline that my family and I travel to a few times per year. And then I'm a big fan of Disney World, Fort Wilderness, those little cabins. Yeah, that'd be great to go there now. Ride around a little golf cart, take the little boat to Magic Kingdom, you know,
So
unplug.
now I have multiple follow ups. So first, have you been to the beach now with your young children since they've been born?
Have not gone with little Walter. We haven't really gone anywhere with little Walter yet.
Yeah.
Yet. But
Well,
we've gone to the beach with little Adelaide, and it is so fun. She's 3 now, and every time we go, she's clearly a different age, and just it's like she rediscovers it every time as a little bit older, and it's just amazing to watch that.
yeah. That's fantastic. Well, what I was going to say was in my experience when our children were young, I no longer found the beach to be very relaxing because it was very much like, oh my gosh, where are they doing? Where are they going?
Don't let them go in the water, right? Don't go in the water. There's a giant ocean, but don't go in it. It's like the ultimate like tease, right? And then we recently, was it recently? It was last year. We took Adelaide with my parents to Disney for the first time, and that was very special because my parents took my brother and me to Disney when we were young and growing up, and so it was really nice to go with my parents.
Oh, that's so great. And did you partake in the Hoop-Dee-Doo review since you love Fort Wilderness?
Okay, Dave, not only have I partaken in the Hoop to Do review, but they have called me up on stage for the Hoop to Do
Oh,
review, and I have been that can dancer
why am I not surprised?
twice.
Twice.
It's so fun. It is so fun. And I mean, Disney does food allergy real well. Disney has some bad press going on lately, no comment. But they do food allergy very well. And so when my families tell me they're looking for somewhere safe to take their kids and they're really on edge about food, it's hard to not recommend Disney.
Yeah, no, from personal experience and as well as from the families that I care for, they all say the
Hmm.
same thing. They really do. They do a great job. Well, next question. What advice would your current self, with all of your infinite wisdom and experience, give to your former self when you were a fellow in training? This can be life advice, this can be professional advice, anything you can think of.
I would say don't be afraid to take the less traveled, right? The
Mm,
road less traveled. in fellowship, I was very blessed to be at a program where they didn't just encourage you to think outside the box. They basically required you to think outside the box. And so when I had some cool bench research going on, also had some cool community outreach going on that they could tell I was very passionate about. These very scientific NIH, fancy smart people, and ultimately they were just so encouraging of me pursuing the outreach that I was doing and growing Code Anna, which is now a national organization that serves thousands of people. And I would just say, don't be afraid of that, past Alice. Like, go for it and be confident and let your passion through, even if it is something that is different from what other people do. And actually, in the bouquet of life, it's nice to be different. It adds more to a program, I would say, to have these different interests and these different passions and different areas of expertise.
That's great. Okay, last one. Do you have a favorite book that you either gift very, very often to others or recommend for others to read?
I do. It's called Never Split the Difference by Chris Voss. I'm not sure if you're familiar with it, Dave.
No.
It's written by an FBI negotiator
Hmm.
and or former FBI negotiator, and the whole point of it is, you can't really just go into whatever negotiation to compromise. You're probably like, whoa, this interview took a funny turn. Why is she talking about negotiating? Every conversation that we have with our patients is some form of a negotiation, right? We have to make sure that we are all on the same page in order for them to move forward with our treatment plan. And how we communicate that is important. And so this book really teaches you how to communicate, how to effectively get your point across so that the team hears you and goes in the direction that is right to go. And that's why it's never split the difference. You're not just going to it's not a win if only half of the plan gets put into place. You need your whole plan to get put into place, right? But it needs to be done through shared decision making, which I know, Dave, you're also a big fan of shared decision making. So yeah, never split the difference. It's also good for contract negotiations with our fellows. You in this day and age, you've got to be able to communicate and advocate for yourself. And so I love that book, and it's great on audiobook too. And I just
Oh,
randomly listen to bits and pieces of it.
that's fantastic. Thank you for the recommendation. I'm going to download it today.
You're
Oh,
welcome.
well, Dr. Hoyt, thank you so much for taking time to be with us. I think this was a great conversation. We're going to put the link to the online course in the show notes for those who access it through the website. Is there anything else that you'd like to add before we depart?
No, God bless you, Dave. Thank you for having me on.
No, it's been our pleasure. Thank you very much. We hope you enjoyed listening to today's episode. Please visit www.aaai.org for show notes and any pertinent links from today's conversation. If you like the show, please take a moment to subscribe to our podcast through Apple Podcasts, Google Podcasts, or Spotify so you can receive new episodes in the future. Thank you again for listening.